Barbara Axon. I'm the chair of Greater New Bedford Allies for Health and Wellness. And we're really very pleased to see so many people who have come to our third annual Health Equity Summit. We have done a number of these. They're an annual event. In the past, we've dealt with issues such as community health workers. And this year, we are focusing on a very important issue, very important people, veterans, who have given so much, and we really want to make sure that we're taking care of them and we're working together on this. So it's my pleasure to introduce our keynote speaker, Cheryl Lucier-Pop. And Ms. Pop has an impressive resume here. She served for 3 years in the Massachusetts National Guard, where her most recent assignment was in the Deputy Chief of Staff Personnel. Excuse me. During that assignment, she oversaw personnel preparedness for one of the largest deployments of the Guard and became involved with the National Yellow Ribbon Working Group. The working group developed a template for state programs based on collaborations with federal and state agencies to enhance programs to assist service members' reintegration with their families, employers, and communities. And her passion for working with her veterans led to her second career at the Massachusetts Department of Veterans Services upon retirement from the military. Now, as the Deputy Secretary of this program, Services and Personnel for the Mass Department of Veterans Services, Cheryl had the oversight of outreach programs, including the Women's Veterans Network, the Workforce Investment, to include 3 workforce grants, housing and homeless prevention, suicide prevention, external affairs, media and communication, as well. She was the liaison for all the joint commands with the National Guard. Are you tired yet? Okay.
You don't have to read it all.
I don't have to read it. I think that people should know what this lady is. As without further ado, introduce Cheryl Lucier-Pop.
Thank you very much, Doctor, for that introduction. And my voice is on the raspy side, so I really do need the mic. Apologize if the volume is not enough or too much, just let me know. So thank you for having me here today, and particularly I want to thank you for your interest in serving veterans, especially in the community and forming collaborations and coalitions to provide care and services for them. So I thought I would talk about 2 things, obviously, the department overall, what the state has in terms of veteran services, and we are fortunate here today that we have 4 of your local veteran service officers who are the best in the business. So I'm just going to touch upon some of those programs lightly because they'll be talking about them more later. And so just you know, generally the whole mission is to obviously advocate on behalf of all the veterans in the Commonwealth and to make sure that they have the services and benefits that they have earned. And we are, in Massachusetts, the only state in the nation that has a very unique financial assistance program for veterans in need, and that's Chapter 115. And some of that includes help with food, clothing, fuel assistance, and then some assistance with employment as well. And all of that, you know, the basic eligibility is the eligibility that you have to be a veteran in the Commonwealth of Massachusetts. There's always an initial eligibility, but that's why it's really critically important that veterans seek out their veteran service officer in their city and town so they find out what they are eligible for. This is just a baseline, once again, for, you need to talk to your VSO. I throw this information up here just so you kind of get a general idea of what the income and assets are that someone needs to make them baseline eligible before they meet with their veteran service officer. And that does not count your car and your house. So on average, this program has been able to save probably at least 10 people a year from foreclosures through this temporary assistance program. I also put this up here to remind that it's not just the veterans who served, their families have supported them as well. And so if a veteran's passed on and you know that they have a family member, please encourage them to visit their veteran service officer. I always encourage them, make an appointment to see their veteran service officer before you think you might need them for something, so that they get to know you. Especially if they're transferring in out of state, they haven't lived in Massachusetts before. So once again, every city and town has a veteran service officer, and I honestly, here are some of the things that they work with, but they obviously, can help you with so many other access to benefits and services. And so we are really fortunate that we have 4 of our veteran service officers here today. And I can tell you from my 6 years having worked at the department, they're the best in the business, or some of the best in the business of all the 250 that are actually in the state right now. And then for VA services, for Veterans Affairs, we actually have 2 offices, and we're fortunate that we have Paul Brawley from the Providence VA, who's with our contact office, and they help with claims and other different processes in the VA offices. So we have a contact office in Providence, and then we also have one in Boston, in the JFK building. And so you can also assess those through the local VSO. So it's always good to go to your veteran service officer, and then also if there's a claim that's being filed on behalf of someone, kind of contact again through the contact office as well. Now I show this, and this slide isn't the greatest to see at a distance, but this shows fiscal year 2013 for expenditures for VA. And I will say that we have VA representatives here. We have some of the best VA hospitals, in the country here at medical centers, but we still don't have all of the veterans who could be eligible signed up. So where are they going? They're going to your emergency rooms, they're going to your community health clinics, to your centers, to your emergency rooms. So one of the questions is make sure that they have signed up, if they're eligible for VA, and then obviously to also be aware, as you're here today, to find out about what other services you can connect them with. But so here, total expenditures out of population of 374,000 was, over $2.3 billion. That's finances that comes into Massachusetts, that comes from the federal government. Now, some of that is for actual construction. We have $20 million for that. That's jobs. That's keeping people employed just in that. And then there's voc rehab of $192 million, and then compensation and pension is $985 million. It's still not what every veteran is taking advantage of that. And I'll tell you one of the instances that I've seen. I was at the Topsfield Fair. We had an exhibit table set up on benefits, and I was there with Ron Koontz, who's a Vietnam veteran, Purple Heart recipient, and a gentleman who I had known, he had kids at the same school that my kids went to, came up and we chatted for a bit, and I said, he said, yeah, I'm a veteran, but I've never really applied for anything. And I said, okay, so you served in the military? I didn't know that. And he said, yeah, I was in Vietnam. I said, oh, no claims, no problems? Or he said, well, yeah, I had a little cancer, but I don't need that. This is for somebody else, which is, I think, kind of typical of the veteran population at large. A lot of our Vietnam veterans especially are like that. He said, I don't really need it. And I wasn't really deep in the jungle. I was kind of along the perimeter. And that's when Ron Koontz stepped up, and that's where that element of peer support is so important. Because he looked him in the eye and said, were you in the Mekong Delta? 1 foot in there. And he said, yes. He said, well, then you need to sit down and start to file a claim. So I put this information up here for several reasons. but also to try to make sure that that veteran, and I try to say this to returning veterans when they just come back from Iraq and Afghanistan, the benefits are out there for you. You've earned them. It's not just some entitlement that's out there for you. So take advantage of what is out there for you because it helps yourself and your family. And I would encourage all of you to advocate on that behalf. So property tax exemptions are also one, between $400 and total abatement depending upon the level of disability. You get those through the local tax assessor's office, but if you're having problems with any of that, please contact your veteran service officer if any of your veterans or their family members or survivors are having problems with that. There's also an annuity that comes out twice a year, $1,000 for a total of $2,000, and that's for 100% service connection veteran or for a Gold Star family, someone who's lost someone that passed away overseas. Cemeteries. I never showed the slide to anyone who's deploying, obviously, but we'll talk about this when we come back. Everyone knows about Bourne. Bourne's a beautiful cemetery, but I don't know if you have ever been out to our state cemeteries in Winchendon and Agawam. They are absolutely beautiful cemeteries, perpetual care, maintained beautifully, so if you are ever by Agawam, or if you're on your way to Mount Monadnock, going up to New Hampshire, you go right past Winchendon, please stop and visit these beautiful places of repose that our veterans have that benefit for burial in either of those locations, as well as in Bourne. Then there is that welcome home bonus, $1,000, and then afterward there's been subsequent bonuses for repeat deployments. I can't tell you how many times I have been to an event or an IRR muster where I find someone who just never got around to signing up for that benefit. So again, when you encounter a veteran and you're talking to them, ask them, did you get your bonus? Did you sign up for it? And that's through the Treasurer's Office. There are other bonuses. What I find interesting, again, if I'm talking to a group of returning soldiers or sailors from Iraq or Afghanistan, they don't ask about the bonus for themselves. They'll ask about their dad's or their grandfather's bonus. Did they get that one? They care about somebody else more than they care about themselves. License plates. There's several, and obviously some of the funds for these license plates support the soldiers' homes. And they can get the V designation, a veterans designation on their licenses now, and that's all done through the Registry of Motor Vehicles. Women veterans, fastest growing population of veterans right now. We have 32,000 women veterans in the Commonwealth, and now they're 15% of the active duty population, 7.5% of the veteran population. And we have a database, obviously the Women Veterans Network, of about 15,000. So there's a lot of work to be done. There's a whole Join the Sisterhood campaign. We have cards here. If you know women veterans, please encourage them to sign up and get in the network so they can find out about benefits and activities and other events that they'll be interested in. The network started in 1997 because we had World War II women veterans who did not know that they were veterans. When they went to try to join one of the posts, they were told to go join the auxiliary. Nothing against the auxiliary, they do wonderful, wonderful work, but the women veterans should be allowed to join the post. So this was to raise awareness that yes, you served, you're actually a veteran, and you're entitled to the same benefits as your male counterparts. So that's how it got started. It continues today. And so that's the network's overseen by Viviana Marcon, but it's a collaboration of the women veteran programs managers at the VAs, at nonprofits. We have there are some female VSOs that are on the network, and they work together to put together some programming for women veterans. Last June we had the 6th annual conference for women veterans that was out at Nichols College in Dudley. And next June it will be held again at UMass Lowell. So there's a lot of information, so we really, really encourage you when you talk, especially if you're talking to some women that may not even mention that they were veterans before. You know, if you're looking through the newspaper, a lot of times if you see there's a male who served, you'll see the little flag. But if you look at an obituary of a woman, you may not see that up there, but if you read, you'll see, gee, she served in World War II for a while. So you want to make sure that before that time, you're taking advantage of those benefits. The SAVE team, we have a couple people from the SAVE team here today with us, Chris and Ashley. SAVE was started, Statewide Advocacy for Veterans Empowerment, in 2008, and it was really a collaboration with the Department of Public Health to have crisis intervention and help, again, it's a peer program to help veterans navigate the system, to connect them to their veteran service officer, to connect them to the VA, to the vet centers, or any other community resources for help. And so they focus on community advocacy. Suicide prevention is really at the core of the program, but we want to get to veterans before they're at that point. So when they are having barriers and struggles, connect them to whether it's employment, benefits, mental health assistance, and then referrals to other programs. There's also a YouTube video called Save Saves Lives that if you punch that in, you should be able to see it. That some of the members of the team are different, but the mission is still the same in what they do. And the state actually contracts with 15 housing providers and 16 outreach centers, and I know Veterans Transition House at least is here today. And so these nonprofits actually provide counseling, access to state benefits. Some of them have federal grants, whether it's Homeless Veteran Reintegration Program for employment, or whether it's service members, veterans and families assistance for housing. They're great resources to connect your service members and your veterans and families to resources and some temporary housing. So they are located throughout the state. Just wherever you are, there's probably at least one or two in your region that can assist you. And as of last June, the two soldiers' homes now fall under the Department of Veteran Services. And so there are two soldiers' homes in Massachusetts, one in Chelsea and one in Holyoke. I'm going to talk a little bit more about Chelsea at the end of this part of the discussion. But just to let you know kind of what they do have for services is, you know, there's obviously long-term care. Holyoke is a much larger long-term care than Chelsea. I think they have about 280 beds for long-term care, where in Chelsea we have 168. They also have an independent living or transition program within a dorm setting in both of the homes. They're working on, we in Chelsea have, VA runs a small adult day health with about 16 veterans, and I know Holyoke is trying to work on an expanded adult day health program at their location as well. But then there's also lots of resources and programming on site. The SAVE team has an office in both of the locations. We have veteran service officers, we have veteran service organizations that come in constantly trying to provide assistance. We have American Consumer Credit Counseling come in, legal services. For example, I know in Chelsea, our veteran service officers, they're every Tuesday trying to help the residents in the homes with change, with applying for 115 and other benefits. All those resources, they have volunteers as well. So there's a lot going on at the soldiers' homes. And then for workforce investment, the department actually has a Boots to Business initiative with the Greater Boston Chamber of Commerce. And that was really started because, you know, you have veterans returning, or they've been home for a while, they're looking for another job, and they've done everything right. They have got on LinkedIn, they put their resume out, they've gone to the Career Center, but they just need a little connection with a mentor that will kind of help them along, and maybe not connect them directly to a job right now, but help build up that confidence and skills and then introduce people to a few people. One thing we try to encourage is to say, even if you don't have a position for a veteran, if they meet the minimum qualifications, at least give them an interview. or at least give them the opportunity to come in for an information interview so they can see what it's like in your agency or your organization. What is it like to work there? What's a typical, or as I call it, atypical day, because there's no typical day. What is it like where you work? To give them that opportunity to have those conversations. And then obviously we have, I think, 32 one-stop career centers around the state where veterans can go to get help, business development, and assistance. They mentioned the web portal here, and I know Kyle Toto is here. Kyle was the man with Mass Vets Advisor before he went to work with the VA. This was a huge collaboration on a state, local, federal, nonprofit. There was a lot of work that went to putting this portal together. And the reason for Mass Vets Advisor was so that some of our, and I say returning veterans, I don't talk about ages at all, because when you see the National Guard and Reserve, they have 59, 60-year-old veterans that are using that technology while they're deployed. So they're used to going online to finding their information. So the idea of this portal was to give you a chance to find out what you're eligible for, because there are over 400 programs. Not everybody's eligible for everything, but they may be eligible for some of them, and you can go and type in when you served, where you served. If you're a family member, you can type information, so it will give you a lot of connections. And that's, you go up there virtually, but then once again, the number one stop on that portal is, how do I find my Veteran Service Officer? If you type in your zip code, you can find your local Veteran Service Officer. I think one of the things we have asked to modify is to be able to put the town in, because I don't know the zip code to New Bedford, so I want to just write in New Bedford so it can connect, and I can find Christopher Gomes by doing that. So that's a great site. The Veterans Laws and Benefit Guide is published by the Secretary of State. That needs some revision to that. I think the last edition was about in 2011. So we'll be working on that. I'm sure they're working on that revision. But the Attorney General's Veterans Resource Guide was just very recently updated. That's in hard copy, but you can also click it and get it online at that link. You can also print it if you like to actually see the print material. This gives you an idea of what's available around the state. It's a good visual to show where there are homeless shelters, transitional housing, where the vet center counseling centers are, VA hospitals, VA outpatient clinics, or what we call the CBOCs, one-stops. It gives you a good representation of the fact that there are resources throughout the state that veterans can access. And I'm going to ask this question, this is kind of a mantra we've been trying to get out in everything that we do, is to ask the question. Don't ask someone, are you a veteran? Because they may say no, or they may not answer you because of what I just mentioned before. They may not think that they're veterans. But if we ask, did you ever serve in the military? Then you'll try to find whatever branch they were at. And we also ask family members, because families are affected by military service, as we know. And there are a lot of initiatives out here for military families. But what about veterans families? What about 10 years after that deployment, when now that child is in high school? And they may not say, is your family member serving in the military? But mom or dad served 10 years ago. So there might be some help that they might be able to get. The American Nurses Association has a huge campaign on this right now to try to connect. At every point of entry, if we ask this question and then connected to veterans, connected that military family member to some other service, it would be such a better way of making sure they access the service by asking this question. So that's, basically the contact information for the state. And if you can bear with me for a minute, I'm going to switch over to the Chelsea presentation. Their setup is a little bit different than ours, but, we're kind of, the spirit of the service is the same. So this is like an aerial shot of Chelsea, just so if you've never been there before. This is our We have this massive water tower that you can kind of see for wherever it really needs a serious paint job, but it's there, it's a beacon. People can always see it as a land. It's actually, the light on the top is an FAA landmark. But for the campus, there are 11 buildings on the campus. The first building was built in 1882. So it was built really for Civil War veterans who were struggling with the wounds of war, whether they called it soldier's heart back then or some of the injuries that they had in the Civil War. That's how the home had got started. So there are 11 buildings, 20 acres. 2 of the buildings are vacant right now because they have some structural issues. But we have a hospital building. We actually have, the Archdiocese has a church on campus. We also have a Jewish chapel and a Protestant chapel or ecumenical room. And then we have an administration building and then basically 3 dormitory residences. And then the Quigley Memorial Hospital is our long-term care facility. So basic eligibility to the Soldiers' Home is the same thing for any veterans. But obviously there's some additional criteria. And so there's an application that an incoming veteran fills out, and there's a period of sobriety. We do CORI and SORI checks based because of the population to see if that is really going to be the best fit for someone to be living at the Soldiers' Home. And obviously the whole mission of the Soldiers' Home is to provide high quality care with honor and dignity to those who served our nation. So in our long-term care and skilled nursing, it's a bed capacity of 174 and 95% occupied. Right now, the capacity is about 168 because we're in the middle of a life safety project and a new nurse call system. And then the waiting list is long, for long-term care and Alzheimer's, and particularly for women, because currently, the configuration is open ward, so it doesn't have the right facilities for women to be on a whole ward unless they had it to themselves. But we're working on that to try to increase capacity. So our demographics, we primarily World War II veterans in the long-term care, and then Korea, Vietnam, and 2 peacetime veterans. And then in our dorms, the capacity is about 305, but as I mentioned, with 2 buildings not being able to be used, it's really more like about 260. So currently we have 217 veterans, and then, obviously a large population comes from the homeless community. And as you see here with this demographic, it's mostly Vietnam and Vietnam-era veterans that are in the dormitory. And then between the ages, the most of it in the domiciliary service are, between 61 and 70 is primarily. And then we have a transitional unit within the dorm, and that's funded, some of the funding is along with the VA, and that's 2-year, it's aimed to be a 2-year program, and it has highly structured case management where the resident develops goals and they try to achieve those goals with the idea of really returning to independent living. Because that is the goal that we really want our veterans to have, if at all possible, is to return to the communities. And that's what the services are. Just to kind of give you an idea what our funding stream is, a basic budget for operating the home employees is about $28 million from the state, and that goes between salary. We have about 374 employees, and then obviously utilities, pharmacy services, and maintenance. And then the other, what we call our retained revenue account, our funds are overseen by the Board of Trustees also. And comes from license plate, and then, and that goes into really operations and maintenance for the home. Which when you have a home that's 132 years old in many buildings, there's a lot of maintenance that's needed. And I'm showing you this picture as we're here in this great big room with a lot of people, a lot of energy. We had our first Veterans Expo that was ever held at the home on October 15th, with the idea of being able to bring the services up to the home, so that not only could the agency see kind of what the mission of the Soldiers' Home was, but also so that the Soldiers' Home residents could see what what was available in their communities. As I mentioned before, we're very fortunate that we have members of the SAVE team and the Women Veterans Network stops by, and they have a permanent space in the Keble House, although they're not there all the time because the operative word and outreach is out, so they're normally out in the community. But they do have office hours specifically so the residents can come in, but you do have that space there. And that's our contact information. We actually got on Facebook and Twitter this summer, which was a new experience there for the Soldiers Home, but we're on there, so we ask you to please follow us and friend us. And I thank you for taking time to listen, and I really deeply want to thank you for your commitment in serving veterans. The collaboration in the communities is so key to enhance service delivery and to make sure that there is equity and capacity and access to all healthcare services. So I thank you very much for your time.
Mayor John Mitchell from the City of New Bedford, who's done a great deal to further all of the work that's being done for veterans in the community, and he'd like to say a few words. And I'm not a technical person, but I think you need to turn yours off.
I'm sorry, I'll go without a microphone. I don't want to complicate things. I wasn't on the schedule, but I wanted to come by more than anything else than say thanks to all of you. Thanks to Carrie and Barbara and Marianne for sure, Poppy for coming down and giving us a presentation on what's going on at the state level. We take a great deal of pride in Greater New Bedford in our patriotism and in our willingness and capacity to take care of those who shall have borne the battle, to use Abraham Lincoln's words. We've seen it in the parades that we've had in the last couple of years, which have been probably the best two Veterans Day parades in the last couple of years, and our veterans agent Chris Gomes was instrumental in making that happen. But it's more participation, more veterans involved, and although vet parades are in many ways symbolic, they are a reflection of how a community treats its veterans, and so it goes with services as well. We do a really good job here. New Bedford, according to state figures, has the highest per capita number of veterans of any city in the Commonwealth of Massachusetts, which is both a reflection of the patriotism of this community, but also a reflection of need. We all need to step up for our veterans for reasons that are obvious to everybody. Because they deserve our care, and because future generations need to see how veterans are treated. If we are to preserve our republic, to get people to serve, to get people to understand the nobility of military service, they need to know that what they're doing really matters. And so that's where it all comes down to us to step up for veterans. It just doesn't happen automatically. An event like this elevates the profile of and the importance of caring for veterans, and we have to be vigilant about it because obviously there were many new veterans who are coming back from more recent conflicts who have needs, and then there are the veterans from older conflicts who develop new needs as they go along. We've got to be there for them, and it requires a certain level of vigilance, a certain level of focus continually to be successful. And so an event like this, bringing together a service provider network in Greater New Bedford, is exactly the way it should be done. And so, let's make sure that we leave here with a full commitment to figuring out what those new needs are, what resources are required to meet those needs, and keep at it. You guys are doing a great job. You've got the full commitment of the city, and all of you know Chris Gomes, our veterans agent, who does a fantastic job day in and day out for veterans. We've been after it. We're going to keep after it, and it's the right thing to do. And we're very proud of the level of services we provide. So thank you, everybody, for coming together today. We really appreciate it.
So we'll now take any questions for Cheryl. Yes.
I need to ask you a question. How many of you have served in the military or are still serving? Thank you very much for your service. I apologize for not catching that first. And how many of you have family members who are serving or who have served or supporting? Thank you for your service. So obviously we have a large contingent here that's got some kind of connection. So when I talk about peer support and lived experience, you know it. You certainly know what that is. Are there any general questions of me?
Does the state have any plans to increase beds for elderly veterans? I know that out in the field, we're running into a lot of people that have nowhere to go when they hit that point where they need more care than just getting an apartment or an SRO will handle.
Well, there is established, and I didn't mention this and someone else may, but there's been two forms of legislation over the past year. It was 2 years ago was Valor Act 1 and then Valor Act 2. Valor Act 2, I can't go into all the specifics because there were like 36 provisions. But two of them in particular are important because one of them was a behavioral health task force that's looking at behavioral health needs. The other one, which I'm very interested in, is long-term care, studying the Long-Term Care Commission to look at the needs of veterans and then maybe sometimes even their families as they approach having, needing long-term care in the future. That commission has now met twice. I believe they're going to be meeting on a monthly basis. I think what's going to be very important is they will probably be doing site visits, tours, walking tours. The meetings are open to the public. So there will probably be an opportunity to raise that issue and concern. I can tell you just from being at the Soldiers' Home, we have two elements. We have independent living, and then we have long-term care. We don't have assisted living, and that becomes a challenge when a veteran's no longer really able to live independently, but they're really not ready for long-term care. So there seems to be a greater need for assisted living. And obviously there's aid and attendance that you can get apply for from the VA to be able to have that to help you with ADLs or activities of daily living. But I think that commission, one of the questions they're going to ask is what are those needs? And they may not know that there's a huge need. I don't know if you're mentioning just in this region where you live or other regions or if it's statewide and where those gaps are so that they can be addressed. Because maybe they'll be looking at having more kinds of long-term care facilities spread out geographically where the veterans are. Did that kind of answer your question?
Yeah, because I've talked to people at the Soldiers' Home, but when you have somebody who's homeless and they're right there at that point, I think they can't wait, obviously, 4 to 6 months for the entry.
Right.
And so where do you put them in the meantime and that kind of thing? This was just sort of like a big gap. Right
Would
there.
you see that those are assisted living candidates or
I would
long-term
say
care?
I would say mostly what I'm talking about is more like assisted living. They just more or less can't go out on their own because that's what our program does, but there's people that I just would be very uncomfortable placing independently because of the issues that they have.
And that's good, important news for me to bring back. And if there's anyone else that has any other input on that, I appreciate knowing that, whether it's Paul or any of the DSOs, the other resources. And then maybe it can be something addressed during the panel discussions. We should also talk a little bit later. Let me get your contact information so I can connect you. Is that it?
Question.
Oh, sorry.
I have a question for you. Recently I was listening to a webinar, it was about planning the stand down, babies and drills and things like that. They mentioned that one of the growing concerns that they're going to address is the number of veterans that are females that are homeless with children. And do you know to what extent that is occurring in Massachusetts? I mean, it's considered a national concern based on that webinar, but I'm just not sure how does that reflect in Massachusetts.
Okay, so the question was, is the number of homeless females with children in Massachusetts? Obviously, that's a concern for homeless families. And that's the reason that you have those grants from the SSDF grants that will try to provide housing for veterans with families, and a lot of times women with children, because a lot of our women veterans are single parents, and there are women that do come back from the deployment and find out they're single parents, and it is an issue because the traditional shelter system doesn't really account for that. I don't know what the statistic is, particularly in Massachusetts. I can try to find that for you, but there are programs addressing that now, and I know there are some providers that are working on that issue as far as establishing housing specifically for women and children. I think one of our providers here actually had housing for women at one point, but they couldn't have children. So that, I think, is where it becomes an issue, because you have to be able to have children with you. But it is obviously a need that does have to be addressed.
You're talking about provisions and what is being for behavioral health, and I wonder if you could tell us more about that provision.
So that's a task force, and I believe there are about 12 members on that commission. I'm not sure if that's met yet. I believe someone in the Department of Veteran Services office was doing because they have to get background checks and everyone to be appointed on the commission, but I know that, for example, there was a representative from the home-based program, probably someone from the VA on that, to just look at someone from family programs to look at all of the different issues. Years ago, they had what was called the Hidden Wounds of War Commission, and out of that, there was, again, looking at some of the other features of looking at military families, looking at the military compact, and then again, this study will look to see where those service gaps are. I believe right now the Mass School of Professional Psychology is doing like a gap analysis of all of our programs to see where those needs are. And so that will probably be part of that report will be part of what the task force is looking at. Because you probably look at the issue of women veterans and children as well, because that is where we have found when you're trying to place someone, a lot of times they don't even want to tell you that they're homeless because they're afraid they're going to lose their children, when in fact, they can actually get shelter through Division of Children and Families and actually get placed and get some support. Yes?
I'm a retired VA employee, and but I think our biggest problem is that a lot of the people who come back that serve don't think they need to be signing up at that moment. I know the VA started going to the battalions and the areas so that they could tell them to sign up now, because if you wait and try to get in the VA system 20 years, it's harder than if you sign up right away when you get out of serving.
That's correct, and I know a lot of what we call yellow ribbon programs when soldiers and sailors, Marines, Coast Guardsmen, and the Air Force airmen are returning. We try to get them to sign up then. They put it off. I'll get around to it, just like the welcome home bonus. So I believe, and I think if Kyle can answer this question, I know that the VA had actually done a muster, I thought, on a VA campus with some folks recently. Has that happened to try to get that? Because if you can actually get someone on the campus, that helps them to sign up.
The only deal may have been one in Bedford, but I'm not 100% sure about that. Not in Providence, no.
But you're right, delay, that's why the advocacy is so important, because people wait such a long time, because they just, and we mail home a welcome home packet, and when I talk about the muster, I had been to one it was actually the JPVA, it was an Army IRR musters, who were really not happy because they knew they were mustering because they were probably going to deploy overseas. And, the commanding general had come to me to ask what kind of benefits we had here in Massachusetts. And I said, he asked if we had hunting or fishing licenses, and I said, no, General, we don't. But this is what we do have. And he was like, oh my goodness, go see this lady over here. And then the treasurer's office was next to me. And it was on the campus of the VA, so they signed up for healthcare then. And they got their VA cards. One gentleman qualified for over $2,000 in bonuses. And then he also went over to the treasurer's office and found he had some unclaimed property of about $2,000. So when we're able to kind of get together and sometimes bring all those benefits to those returning veterans, then that's when we're able to get them to take advantage of them. But that is a clear issue.
I know
And
that.
the VSOs can probably comment on that when they're up as well.
I actually just wanted to say, I'm also a VA employee, current. Hi, Arthur. I just wanted to say that I will actually email Dave Hankey, who is our outreach coordinator for the VA Boston, to really kind of talk to him about getting things done on campus, because I know he does a lot of outreach events where he actually goes to sign up people at like Red Sox games, like anywhere and everywhere he could possibly sign people up, he's signing people up. So I will actually send a message, see if we can kind of coordinate something to pull in as many people as possible to actually get people on campus.
And I know Colonel Henka actually because we served in the Guard together. As a matter of fact, he was the mobilization officer when I was the G1. And so then he came and he actually kind of took over what I was doing with Yellow Ribbon. And then he came to work for the VA. I think he may be either on some duty someplace or on vacation. I saw him out of office reply. I'm sure he'd be here otherwise.
That's why
So,
I don't have all of this
yeah.
stuff, because I couldn't get a hold of
Yeah, he comes to just about every event everywhere and does manage, whether it's food banks or expos, and does sign people up. But what you hit there is a very important piece. And that's when everyone at that muster, I said, I sent you a packet. Oh yeah, I got it, I tossed it in the corner. So now we'll say, okay, when you get the packet, at least put it someplace where you will find it, so that when you're interested, you go back and look at it. And that's why continued messaging and marketing is just really important to make sure that we're getting that message out to the veterans. And their families, because sometimes if you get it to the families, they'll make the veteran go for it.
One last question. Your PowerPoint is powerful. You had a lot of good information to share. Is it possible to share that PowerPoint with GMBLI so we can post it on our website?
Sure. I believe that PowerPoint, all the veteran service officers have something like it too. And then they tailor that to their specific communities. I think Keith Jones sends it out to do it however you want to. He usually sends it. Because it's kind of our basic outline that we can add to when something else comes up. Because I'm sure I missed something important on that. But we're happy to share it.
That'd be great. Thank you.
What exactly is the scope of the benefits for the family? Scope of the benefits for families? You indicated that there's no family.
Okay, so if you have a veteran who's passed away, and now you have a widow or a widower, and they're coming on some difficult financial times, then they should still be contacting the veteran service officer, because they may be entitled to Chapter 115 as a survivor benefit. And then I mentioned the Gold Star families who's lost someone, that was either killed in action or, died on active duty. So those families, they receive the annuity and they may be eligible for other benefits, because there's always another program or benefit that comes up for family members, sometimes for siblings, whether it's scholarships, that they might be eligible for. So there can be a lot, and that's why this table here, they're the ones you need to be talking to about, really drilling down into the specifics about what's out there. Because I am amazed at how much new information there is all the time, and how many new benevolent programs there are out there outside of just the state and federal benefits to assist our family members and veterans.
Ma'am, as a pretty National Guardsman, not myself, are they eligible for any VA entitlements
When you say
when
where
they
you're just
graduate from
coming right in,
AIT, advanced individual training? I don't know if you know that.
I don't think, I don't know of anything in general. I think you have to have a full term of enlistment for even being able to get a VA loan.
180 days, consecutive days on active duty.
Right outside of your basic training. There have been some, again, this is why you really need to get into the details, because sometimes there will be some little nuance. Someone was kept on longer because maybe they had a medical issue, and then they may qualify. I know before 1980, I think it was, you only needed like 1 day of active duty before that time. But the rules change, and it is very confusing. And that's why it's important to sit down with a veteran service officer who knows a lot more than me. Or Paul Brawley, who knows more than everybody. But if you have specific instance or circumstance that you know of, you should discuss it with someone. Any other questions? So what's next? Thank you so much.
We're now going to take a brief 10-minute break. We have some wonderful resource tables located over there with tons of information. If you want to partake of that, then we'll reconvene in about 10 minutes for a panel. We have coffee, tea over here. Help yourselves. So we'll see you back in 10 minutes.
But I'll tell you something. I'm sure
So if everyone wants to start wandering back, we'll have more opportunities for networking and checking out the resource tables. But we'd like to get going with our panel because I think we'll have we have a great panel today, and I think we'll have lots of great discussion. On our agenda, we did have Georgia Simpson-May, who's the Director of Health Equity for the state, is going to come. Unfortunately, she can't make it, but that will give us a little more time for the panel here. My name is Carrie Mello. I am the Community Benefits Manager for South Coast Health, which includes St. Luke's here in Bedford, and Charlton Memorial in Fall River, and Toby Hospital in Wareham. And in my role with Greater New Bedford Allies, I chair our Health Equity Committee. So I wanted to just talk a little bit about what the Health Equity Committee does. As Barbara said, this is our 3rd annual summit. So we try to raise the profile and some of the issues connected with health equity in our community. And we hope to have these kinds of summits every year. This year, we wanted to focus on veterans issues because it's something that we discuss at our meetings. We meet every month on the 2nd Monday at 9 a.m. over at the Department of Public Health. And we're always welcoming new members. We have great discussions. We've done some projects with community health workers and their work in the community. And we're lucky to have Cecil Hickman as a member of our group. And he's kind of opened our eyes to a lot of the health equity issues affecting veterans. So I want to introduce our panel today. We're really fortunate. We have 3 veterans who are part of the panel and some other experts who can kind of lend some light on some of the resources that we have both regionally and locally. So first, let me put my glasses on so I can see. I first want to introduce Dan LeBlanc. He's the Veterans Agent currently in the town of Freetown. He was formerly the Veterans Agent for the city of New Bedford. He's a graduate of New Bedford High, and he enlisted in the U.S. Marine Corps in 1965 and is a Vietnam veteran where he earned many medals, including the Purple Heart. In 1972, Dan joined the Department of Veterans Affairs, where he worked for 27 years at 11 different VA medical centers all throughout the country. In 2002, he became the Veterans Agent for the city of New Bedford and really expanded the scope of what that office does, going from serving 53 clients when he first came in 2002 to over 530 in 2010. And that is the highest number of clients per capita for any city or town in the Commonwealth of Massachusetts. He's also the recipient of many numerous private and public awards, including, this one sort of stood out for me, the New England Patriots Community MVP Award, which he was awarded in 2006. So we want to welcome Dan. Along with Dan, we have Chris Gomes, who is the current Director of Veterans Affairs and the Veterans Agent for the City of New Bedford. Chris is a graduate, another local guy, graduate of Greater New Bedford Voc. He enlisted in the Army at the age of 18 and served 2 tours of duty in Iraq, where on his second tour of duty, he lost his leg in an explosion. He was a sergeant in the Army, and I was reading, and it really was kind of a heroic story. He managed to kind of coordinate all of his men, and even though he was severely wounded. And he was appointed the Veterans Agent within the last couple of years. Interestingly, Dan, I've read, helped Chris when Chris came back from his tour of duty. And I think that's the theme of today, is veterans helping veterans. It's a very effective thing, and it was nice to read about that. And Dan and Chris will speak about some of the local resources that are available through your local veterans agents. We also have Helena De Silva Hughes, who is the director of the Immigrants Assistance Center here in New Bedford. And Helena is both a local, regional, and even national expert on immigrants affairs, and we're very lucky to have her here in our community. She's been with the Immigrants Assistance Center for over 22 years. She's a graduate of UMass Dartmouth. She's managed to expand the scope of what the Immigrants Assistance Center does, both locally and regionally. And if you were watching the news or read the newspaper this morning, you'll see that she was tapped for comments on President Obama's speech last night about immigrants. And she's going to speak on some of the legal issues that affect veterans, particularly veterans who may be immigrants. They face a lot of significant barriers. We also have Stacey Edwards, who is a licensed social worker. She works for the VA in Brockton, and her position there is Suicide Prevention Coordinator. The program that she runs offers support to both veterans and staff regarding concerns with suicide. In addition to providing direct treatment, the team also provides trainings to the hospital staff at the VA and also the community regarding the prevalence of suicide and suicide prevention. The team consists of 2 full-time suicide prevention coordinators who are resources for veterans and their families. Stacey attended Dickinson College and also has a Master of Social Work from Boston College. We also have Ben Clough, who works for the Department of Public Health. Ben is in a new position. He's the coordinator of Veteran Services for the Bureau of Substance Abuse, and is beginning many new support programs and has a number of resources for veterans who are grappling, and their families who are grappling with the issue of substance abuse. And Ben deserves credit for being the person who came from the furthest away today. Ben drove 130 miles this morning from up near Vermont to be here with us. And last, but certainly not least, we have Cecil Hickman, who I think many of you know as someone who is working tirelessly on behalf of veterans in our community. He is a veteran of the Vietnam War. He is a graduate of the University of Missouri, and he's had a long and very illustrious career as a journalist. He's been a broadcast journalist in radio and TV. He's run his own media company, and he's a tremendous resource, I think, to all of us in the community, because in addition to just knowing a lot about veterans issues and veterans resources, he knows how to communicate that and get the message out. So he's helping all of us do that. And he's going to talk about, he started a project called Dog Tags Navigators. So he's going to talk about those kinds of resources that he provides. What we'll do is each person will just speak for about 5-7 minutes. We have a little bit of extra time, and then we'll hold questions until after they all speak. So I think, Dan, maybe we could start with the local, Dan and Chris, the local veterans resources.
Okay. Thank you. I get the microphone. I think what I wanted to do when I first got the call from Marianne about coming today was to make the distinction, which is what I try to do with my 45 years of dealing with veterans in the system, either in the federal system or in the state city system now, is to make the distinction between the VA, the federal sector, and the state. Chapter 115 that we've heard Cheryl mention in her presentation is the only program of its kind in the country. We've been around since 1861. We were funded after World War II and have been funded ever since. So over 60 years, the state has funded our program. Our program is a funding assistance program for veterans and widows of veterans, veterans who are married, who have families, widows of veterans who live in our communities. We provide financial assistance. Now, there is, like many of your programs, criteria for that. And for us, it's a financial criteria. Once the veteran proves that he has an honorable discharge, or the widow can prove that she was married to the veteran with an honorable discharge, we can provide financial assistance to them. And I think the basic purpose for our program is to keep those individuals in their home. To keep them in their home as long as they can, whether they own the home, whether they're mortgage-free. I think one of the things that I put in my bio was my service in the city of Bedford. And that number that was quoted when I first started in 2002 was 53. That was the number of active clients receiving benefits on Chapter 115. What I did is I did blurbs, and I'm an advocate of outreach. I did blurbs in the Senior Scope. I put things in the newspaper. I was on the local cable television show. I was on BSM as often as they would allow me. Standard Time did some articles, and it was really to outreach to those individuals living in the city of New Bedford. And all I said was, if you're living in housing, and New Bedford has a tremendous number of housing units, if you're living in housing, and you're an honorably discharged veteran, or the widow of an honorably discharged veteran, you need to call me. Because being in housing automatically qualifies most people because of their income level. And those same people are eligible for additional financial assistance through the Chapter 115 program. And the numbers just, like she said, they went from 53 to over 530. Chris currently has 450, 460 now?
To 475.
475. So the numbers are still up there, and that number, that per capita number that Mayor Mitchell referred to, and that was referred to earlier, that per capita is the number of individuals receiving benefits in the community compared to other communities in the state. Now, Chapter 115, as Cheryl mentioned, there are 250 of us in the state representing all of the communities in the Commonwealth of Massachusetts. Within the Commonwealth, if you have a residence population of 12,000, less than 12,000, you have to have a veterans agent, but that veterans agent is part-time. I'm part-time in Freetown because our population is 9,000. When I was hired by the town of Freetown shortly after I retired from the city, I left for about a year, and the gentleman who was in Freetown resigned, so they contacted me about taking that job. I took that job in 2011. When I first started, I had 6 clients. I've had 33 clients come and go since then. I currently have 19 clients on my rolls. That's an example of outreach. If you put yourself out there as a veterans agent and let people know that the program exists and you offer them assistance, I used to tell my widows when they would come in, your life is going to change. When you talk to me, your life will change because you're going to get more financial assistance to to help you do the things that you can't afford to do now. And it did, and the hugs and kisses I would get from the widows was gratifying to me, because I tell them, I'm going to treat you like my mother. That may not be a good thing. Because I'm always yelling at my mother about the things that she doesn't do, that she should be doing, because she don't listen to me. But it is a good program, and it is the only one in the country. We're the only state that does this. Don't confuse what we do, your veteran service officer does, with what the federal government does. The VA provides compensation and pension to veterans. They provide widows benefits and DIC, which is widows compensation to widows, and that's all subject to eligibility. Paul Brawley is our Massachusetts Veteran Service Officer for the Commonwealth out of Providence. Paul is a tremendous resource to all of us who are in the communities. When we take an application for compensation and pension, we refer those individuals, at least I do, to Paul Brawley. Paul Brawley is what's referred to as a NSO, a National Service Officer. He's trained and qualified by the VA to represent our clients in their claims to the VA. Now, I've got to say this. I tell a lot of stories, and I know you pull a plug when my time's up, because I'll talk forever. I filed a claim against the VA back in 2005 for an injury that I have. In addition to the injuries that are obvious, there are a lot of injuries and a lot of disabilities that some of us, like Chris and myself, have that are not obvious. It took 9 years. My claim went to numerous appeals, numerous denials and appeals, and finally ended up in the Court of Veterans Appeals. That's like the Supreme Court of the VA. At which time, a legal firm in Washington saw my claim. That was denied. They contacted me and said that they wanted to represent me in the Court of Veterans Appeals because they felt that the VA had made 3 clear and unmistakable errors in their denial, which I agreed. But my concern was, okay, you want to represent me, but lawyers don't work for nothing. And I don't want to give up anything. I've been fighting and fighting for all these years, and this is now 2012 when this happened. End result of that claim was that the judge ruled in favor of the attorney, my attorney, against the VA's attorney. And my question to the law firm was, well, who's going to pay you? You're going to get a percentage of my retro if I win? And they said, no, we get nothing from you. You pay us nothing. If we win, the VA, the judge can order the VA to pay the legal fees. Well, that's exactly what happened 2 years ago. It came back on what they call remand, more compensation examinations. I've had half a dozen comp exams relative to the injuries that I was claiming. Paul called me 2 months ago, a month and a half ago. He said, you're not going to believe this. He said, you won. My claim was approved by the judge to award me the benefits that I've been fighting for the last 9 years. Some of the examiners, when I for my comp exam, the physicians would say, I can't believe this is going on like this. I can't believe they're doing this. I said, it's the system. But I'm not going to give up, and I'm not going to die. I'm going to continue to fight until this is over. I've had other guys who have done the same thing, fought for 10 years on appeal, until you've run out of the appeal process. I told a story a little while ago about a Chapter 115 guy who I helped. When I first started in Bedford, I helped him file his claim for compensation. It took 10 years. He called me one day and said, I won. I get $121,000 in retroactive benefits from the VA. He said, how much do I owe you? Because one of the things that we do is when you file a claim with us, Chapter 115, you sign an agreement to reimburse. So because we base your eligibility today on no income, when you receive a retroactive payment back to the date that you started with us, you owe us all that money that we gave you. I said, well, I had files and files and files of this guy after 10 years of getting benefits. I sent him what we call a notice of action telling him he owed us $56,000. I said to the staff in the office, do you think this guy's going to come back? I This guy, there's no requirement for these guys to pay us back, or ladies. 3 days later, he came in with a certified check for $56,000. The largest refund the state has ever seen on a refund. And he said to me, "You're the only ones there to help me. Nobody else would help me. And you helped me for all these years. I want to pay back the city for what they did." He said, "I got $60,000 in the bank and I'm getting $3,000 a month tax free. I don't need any more. So I want to give you back the money you gave me." And it was extremely rewarding to see that happen, because we've had guys who owe us a lot less than that just walk away, not realizing they could continue to get benefits if they reimburse the city the small amount of money that they have in their hand. But it means so much to think they have $1,000, $2,000 retro, $3,000, and just walk away and not realize that money would be paid back to you in a very short period of time if you refund the city and the state what you owe us. I'll take any more time other than just to say we are not the VA, and they refer to us as the VA representative. That happens all the time, and it's like I have to pound it. People said, "We're not the VA. We are your local veterans agent here to help you locally." The money comes out of the local tax dollars, and it's often referred to, my battles with the city council in New Bedford and the mayor's office initially was, "This is another unfunded mandate." It's not an unfunded mandate. It's a partially funded mandate. For every dollar that we give to our clients, we get 75% back. And my argument with the city council, we went from a $160,000 budget in New Bedford in 2002 to when I left in 2010 to a $3 million budget. Chris's budget is probably closer to that now. $3.6 million that the city gives to him just for benefits. Just for benefits. And they never had a problem getting money at the end of the fiscal year when we run out, because they knew they were going to get 75% of that money back. And that's what a lot of agents don't push in their communities. Now, for those communities that have more than 12,000 population, they have a full-time agent in their community, or required to have a full-time agent. And some communities, like Scott from the Cape, he's part of a district. The Cape is part of 13 communities? 15 communities in the Cape are all part of a district run out of Hyannis. There's 2 full-time agents and 2 or 3 part-time agents, 3 part-time agents that roam from community to community and have office hours at the different communities, so that the clients who are seeking assistance can get that assistance from those agents in those communities at those particular times. Because of my outreach in Freetown, I don't have office hours. When I'm asked by the selectmen in my community, "What do you work?" I work Monday through Friday, 9 to 4, which means my cell phone is on 24/7. I get calls on Saturdays and Sundays. When I go on vacation in Florida, I get calls in Florida because I'm always available. And that's part of what I feel my responsibility is as a veterans agent. Some agents, part-time agents, work a couple of days and that's it. They work a couple of days, couple hours, and their phone shut off, and you got to call the office and leave a message on the machine. I get in those guys' faces, and I'm all done. I have 1 more week next week, and I resign my position in Freetown because after 45 years, I'm tired and physically worn down. My wife and I need to take time for ourselves. But I appreciate Mary Ann calling me and inviting me here. I will continue to be involved with my guy in Freetown, whoever that may be. One last thing, and I know that was brought up by Cheryl, and it is an issue with me as well. Women veterans. When I was in New Bedford, I used to tell transitional assistants when I have to call them to verify welfare income from clients, because you can't take welfare and take Chapter 115. Under the statute, under the legislation for Chapter 115, it falls under the statute for welfare. But it's welfare for veterans, so you can't take both. I ask transitional assistants, when you're interviewing a client, ask them whether they're male or female, if they're a veteran. Ask the question, because if the woman is a veteran, she belongs going to now Chris's office, because the benefits paid out of Chapter 115 are greater than transitional assistance. It did change, and that's all part of why it grew to what it did in New Bedford and why it's grown in a lot of communities. I know I I'm still friends with Jim Cochran in Fairhaven, although he's probably not wasn't happy with me back then when I started doing the outreach, because it impacted everybody. Down in Fairhaven, Acushnet, all of the communities increased their workload because we were doing outreach. And it's a good thing. It's not a bad thing. And the communities, if you're selectmen or your mayors and your city councils, your town fathers and in the communities don't realize the money stays in your community. It's money that these people need to pay their rent, buy their groceries, and pay their medical bills. It's a very important program, and I'm glad I was part of it for the years that I was. Thank you.